Do you have a parent who is being discharged from a rehab facility or a long-term care facility, and you're really stressed trying to figure out how you're going to provide the care that the facility is recommending you get? In today's video, we're going to talk about unsafe discharges from a rehab facility. We're going to talk about why it happens, what you can do to maybe prolong the discharge, and we'll also at the end of the video have some strategies for reaching out to the proper people to maybe affect some change. Our healthcare system is very broken right now, and one of the most affected populations is our elderly population. We have to do what we can do to work within this broken healthcare system, but we can also maybe force some change. Before we continue, I just wanted to quickly introduce myself. I'm Tammy Provenzel. I'm a dementia certified physical therapist and a life coach. And I wanted to emphasize that the videos that I make are separate from my role as a physical therapist working in short-term rehab and long-term care facilities. I've been working with elderly patients and their families for 20 years. I see the struggle, especially in the role of caring for our parents. There's a lot of emotions that are involved in that. So these videos are part of my effort to bring information and strategies to the families that are struggling with how to care for their aging parent. So if you have an elder parent or another elderly loved one and they're in a rehab facility, say they broke their hip or a broken arm or had a fall, and the facility is telling you that your parent is ready to go home, usually that comes from the insurance company. Insurance companies run healthcare. They decide what is allowed and what isn't allowed, and they decide how long somebody stays in the facility. They also decide to what level of independence the person needs to get before they can go home. So historically, Medicare was the biggest insurance cover for elderly population, and they would allow up to 100 days of skilled rehab or skilled nursing as long as the person was making progress. One of the most frustrating things is if the person is no longer making progress. That often happens because when they come into a facility, there's recognition of a cognitive impairment. They might have some short-term memory issues, some safety awareness and problem-solving issues. And so the staff, the rehab staff, will often say this person isn't safe to be alone anymore at home. And when that happens, when that kind of plateau has been met, then even under Medicare, rehab is supposed to discontinue skilled therapy. And that usually leads to a discharge from the facility or a transition into long-term care. More recently, other insurance companies like HMOs and affordable care organizations, and they're supposed to follow Medicare guidelines. So the idea is part of Medicare's guideline is to return the person to their highest level of functional independence. So if the person before they came in was independent, then we can try to reach that level of independence so there's a safe discharge. What I've noticed more and more frequently is that HMOs and affordable care organizations are deciding that once a person gets to the point where they only either need light hands-on assist, so that might mean that you hold on lightly just to maintain balance while the person moves or stands and does a transfer or whatever, or they might need close supervision. So they might not need the physical assistance, but they might need your cues to make sure they do things safely, like using their hands to stand up and using their hands to reach back when they're getting ready to sit, so that they perform as safely as possible. So what insurance companies seem to be doing is deciding that somebody's ready to go home when they're at a contact guard, that light touch or close supervision level. And what this has resulted in is families being told your parent is ready to go, often given a couple of days notice, and they have to come up with this 24-hour care of contact guard or close supervision. And I see the frustration, the confusion, the upset that comes with all of that, and it's heartbreaking. There's often very little coordination of care that comes after the discharge. So the discharge planner will set up some home care services that can include nursing, occupational therapy, physical therapy, sometimes speech therapy, but it's not very often. It's not 5 days a week like it is in a rehab setting. And it doesn't always start right away, and there is such a shortage of staff that I have seen weeks and weeks go by before somebody gets in-home therapy. And it's maddening. So our elderly loved ones are being discharged with very little follow-up, very little resources given, very little coordination of care. and families are just stuck figuring out what to do. Part of what I am trying to do in making these videos is to give some information, hopefully give some strategies to try to see if we can maybe prolong the discharge and or affect long-term change, hopefully. Even before the discharge, I would recommend that you as a family member, or one of you as the family member, talk to the rehab staff. Ask them what level of assistance your loved one needs right now. Tell them some of the things that they need to be able to do to come home safely in your eyes. You can also ask them if they can train you on how best to provide assistance and even to provide cues, so that you have a little more training on what to do for good carryover from the facility to home. When you get the notice of non-coverage, which basically means insurance will no longer cover your loved one's stay in the nursing home or the rehab facility, you have, I think it's 2 days, 48 hours to file an appeal. And I recommend that everybody file an appeal, because at the very least, even if the appeal isn't granted, it makes the facility's job and the insurance company's job more difficult. And if they keep seeing this over and over and over again, I'm hoping that that's going to irritate them a little and maybe force them to make some change. And I'm going to give you a couple of things that I recommend that you say once you're given that notice of non-coverage. If you think that your loved one isn't safe to be home alone and the facility is recommending contact guard or close supervision, that pretty much means 24-hour care, because you don't know when your loved one is going to need to get up and use the bathroom. So as soon as you get that notice of non-coverage, state to the discharge planner, this is an unsafe discharge. My mother doesn't have 24-hour care. You're recommending that, and we can't provide that. I would also make it clear that you're keeping a journal. And you're keeping a journal of everything that's being done, everything that's being said by them, everything that you're saying to them. And then I would also recommend that you talk to an elder care lawyer. A lot of times you can do just a consultation call, and you could run some of these things by them and see what they offer for support. You could also, once you do that, or if you feel comfortable even before you do that, I would recommend saying, I have talked to a lawyer and they are guiding me to do these things. Those 3 things that I talked about, stating that this is an unsafe discharge, stating that you're keeping a journal and you're documenting everything, and stating that you've talked to a lawyer and are being guided by a lawyer, are often enough to get the facility to offer to allow your loved one to stay. Filing the appeal will give you a little more time, because the facility has to pay for your loved one's stay and therapy has to stay in until the appeal is decided. So even if you lost the appeal, you might gain a couple more days. Hospitals, nursing homes, rehab facilities, they are all mandated that they have to provide a safe discharge. And so if they're hearing the words, this is an unsafe discharge, they can end up being fined. They can get into a lot of trouble. So when you use those words, it puts up a red flag to them. So oftentimes it'll buy you a little more time. The next thing I recommend is reaching out to the local ombudsman who is associated with that facility. You can usually find the name, number on a bulletin board somewhere in the facility. I would reach out to them, because they can be a good advocate for your parent. And again, if you feel like this is an unsafe discharge, I would recommend filing a complaint against your state's health department. So if you go to usa.gov, they will have this individual state's health department, and I believe at the bottom of that website they should have a file a complaint area. So I want you to remember that although it feels overwhelming when you hear that your loved one is being discharged from a facility, but you're not alone, and the videos that I'm making are an attempt to help you to kind of work within this system so that you can have a little more support as you go through this. If you found this video helpful, please subscribe. Also share this video with anybody you think might be able to use it. Please comment in the comment section below, including asking any questions that maybe could be turned into a future video. Thanks for watching.